Hello, hello, hello. I am here doing a quick question and answer Wednesday Wellness a little bit early because tomorrow's my birthday and I want to take most of the day off. So if we've never met before, I'm Mary Starr Carter, known as the Total Wellness Doc and Mom. And my background really comes from the chiropractic world, the natural health world, nutrition. I'm an expert in essential oils and have worked in the natural health field for over 20 years. On top of that, I've helped deliver a few babies and had some great internships with lab tech and in OBGYN, and it's just been a blast my past 20 plus years. So, hey Tanya, welcome. All right, so let's dive in and talk a little bit, because I know Tanya is a teacher and there's a lot of teachers sadly who are having to wear the mask all day. Hopefully they change up their mask throughout the day. So I'm going to answer 3 questions that have come into me. One of the questions was about mask acne. I guess it's a new diagnosis. It's called masking. And a young girl, they're using all the treatments and it's not going away. It's just getting more and more inflamed. So we're going to talk about what could be the problem there. Next, we're going to talk about having a rash for years that doesn't go away with a lot of different things that this person's tried. And the third thing we're going to talk about is my experience with, I think I'm saying this right, gastroparesis, where digestively things are basically paralyzed. So let's get started. All right, first Q&A about this new diagnosis that which a lot of people are suffering from is called masking, and it's acne, most likely from wearing a mask. And yes, it is from wearing mask. And so this young girl, she's going to the dermatologist and nothing's working. Why could that be, right? So first up, we need to change our mask often. Some of the materials in the mask, just like people wear gloves, they have to wear certain gloves so that they're not allergic. So you got to look at all those things, right? Some people think the cloth masks are better. My feeling is if you're wearing it all day, they probably are holding a lot more mold, yucky stuff, just not good stuff. So something that is maybe more disposable and or that you are regularly, like almost like if I was a teacher, maybe 5 different masks a day per period, right? I would switch it up like that, especially if I'm breathing into that. So that could be an issue. So sensitivity to the materials, whatever's going on with that, switching that up. But if a person has switched those up, they've gone to the dermatologist, they've tried everything, nothing's working, or maybe they've tried some of our natural remedies that help support the skin, like tea tree oil is wonderful to support the skin. But if nothing is working, then you want to actually look in the mouth. Did you know? Raise your hand. Give me a comment here. Did you know what the dirtiest place in our body is? Well, maybe second dirtiest. It's the mouth. It is full of germs, bacteria, fungus. Oh, the list goes on. It's really bad. Think about it. It has bacteria that can rot your teeth. That's how strong it is. Your mouth, depending on what's going on in your body, is very, very acidic, inflammatory, right? Your saliva can digest things. So this woman's mouth might be causing the problem. She might have some kind of gum infection, a tooth infection, or just really needs to floss better and do some rinses. If I was a teacher or someone wearing a mask all day too, I would probably get my wonderful Thieves mouthwash, swish around with that, and that's my favorite, is the Thieves. On just a wonderful, pure premium essential oil mouthwash. Food grade, right? So swish that around, spit that out. I would do that a couple times, maybe a Thieves lozenger. I'd be brushing my teeth quite often because basically you're not going to get rid of all the bacteria, but you're going to do your best. But you are going to be breathing in your mouth bacteria all day long. And of course, that's going to irritate the body. I bet you for this woman too, something like alkalizing her body would be a great idea too, because if she is very acidic and her mouth's very acidic, then that's going to irritate the skin as well. So alkalizing the body with alkaline water. My favorite is something called Alkalime. It's a supplement I take every single night. I love it, and I'll take it a couple times when I'm feeling acidic in my mouth or in my body. It's just, there's lots of different ways. Some people do apple cider vinegar. My body doesn't react well with that most of the time. So you love Alkalime. Okay, so there's some ideas for the acne, looking at the materials, switching it up quite often, brushing the teeth, using the Thieves mouthwash, using an alkalizer as well. All of those could help with masking acne. I hope that helps you. Okay, next question that came in was rash for years. So this woman had had a rash for years. I think it was going on 6 or 7 years. And she had tried a lot of different things and nothing was working. So any suggestion when we have skin issues, there's two main areas of the body you want to look at. Okay, so when there's skin issues, there's two main things that you want to look at. And let me know if you have comments or questions too. I will try to get to them at the end of this. Go ahead and throw in your health, wellness question, comment in the comments. Go ahead. I'll try to come back to them. Okay, so two main things for rashes that you want to look at are your gut, how healthy is the gut, and two, the liver. The liver has a lot to do with how our body reacts. So a lot of people have things like psoriasis, even eczema, things like that. Something's going on with the gut and or liver. Okay, so the gut is the hub of health, and the skin is kind of a indicator of how healthy our body is, right? So one of the things that she can look for is a condition called leaky gut. And there is a lot of different treatments and aloe vera and yada yada, all that, but really I'm leaning towards a good GAPS protocol, right? And you can look into that, but it's a very good digestive health. And GAPS actually stands for, I don't even know, but I know it's like gastric, something, but it's like our psychology, like our brain, actually affected by our gut. And I will tell you, I've seen this 100% of the time in patients and my own family members. It's crazy. It's absolutely crazy. But this rash for this woman, and a lot of things in our health and in our body, hair, all of that, has a lot to do with the gut. So looking for a good GAPS health practitioner, I have one. If you want that recommendation, let me know and I will get that to you. And I will put that in the comments as well. He's phenomenal. He's helped so many people really regain back their health and their life. To tell you, people who've had rheumatoid arthritis, all of those things. So in rash, just like any kind of autoimmune, it's our body attacking itself, right? So that's what I would look for. The other thing is working with a good mold specialist too. And I can give you a good mold specialist. You have a team member with Gastroparesis. Okay, I'm going to get to that next, Jenny. Hold on. Okay, so looking for a good mold specialist, because a lot of people think, oh, I've been exposed to mold, I'll just take this supplement and I'll get rid of it. Well, it's not actually, there's a whole process, and there's these toxins that come out when the mold is killed, and that can cause a rash. I mean, there's just so much. So getting a good healthcare practitioner who can walk this person, is it the gut? Is it the liver? Is there some kind of mold issues? Things like that too. So I will put those practitioners that I feel are very good in the comments. Okay, next up, we're talking about gastrodiaparesis. Okay, so Jenny says she has a team member, and I remember when my first patient in my clinic came in and shared this with me, and it was just so heartbreaking how traumatized she was, and what was going on, and not a person not being able to digest or poop. It feels like a giant rock in their stomach all the time. A lot of times they're in pain 24/7. Eating is just not comfortable at all for them. And then they have to go the other way and take laxatives and all of these things. So this woman, the question that came in was from a gentleman who has a lot of autoimmune issues going on. And so that's the thing that you have to look at is what is happening. And one of the things she said is he had double vision. He had something like that. And that kind of puts me into a direction like this person may have more of a Lyme's condition, an MS condition, which I feel kind of are very parallel and sometimes misdiagnosed together, because we're seeing people with MS, people with Lyme's who are losing bowel and bladder function, right? And they're losing. I know a friend who has lost all of her functioning, like she's on a bag every day. Her legs are not working. She's in a wheelchair. It's just horrific. So I would look more towards those things that help support MS for this gentleman, right? For the client who came to see me, one of the things that was working for her was enzymes. Her doctor had her on a high dosage of enzymes. It was a little bit uncomfortable, but she was having some success. So we put her on some milder enzymes that we have, and she did much, much better. But guess where her gastroparesis came from? Guess. Anybody know a cause of gastroparesis? Meaning paralyzation of the stomach. Besides MS, besides Lyme's. Anybody want to guess? Hold on, I'll get my drink while you guess. You're not going to believe this. Okay. All right, Jenny's stumped. Most of you are stumped. It came from Ambien. Ambien CR. And if you look at some of the side effects, this is a sleep drug, a pharmaceutical drug that this woman was prescribed because she had difficulty sleeping. And one of the side effects is this paralysis in the digestive system. Crazy, right? Crazy. This drug that's supposed to help me sleep and feel better and all of this is actually caused this. So I don't know if you have trouble sleeping. It's not a clinical condition, but you just have trouble sleeping. Myself and wellness associates like Jenny Got Gage, who are on here, and others, we have solutions for you. We have some natural solutions for you. So please, before you go extreme, right, especially if you don't have a clinical condition and you just need a little help getting a good night's sleep, we can help you. All right, so I think I've answered all that. Going back though to any time that there would be something where the body wasn't working correctly, right? The digestive system wasn't working correctly. There was some kind of paralysis or overreacting or acid reflux or GERD or anything like that. I have to go back to the chiropractic in the spine. And where Jenny is down in Florida, there is a phenomenal doctor, Dr. Lisa Marsh, amazing adjuster. I know there's great chiropractors everywhere, but I would definitely get into a chiropractor if I was having any kind of issue where I might suspect, because the spine, right, the spinal column is like the nervous system is the master system. So if some kind of digestive or organ or hormonal system isn't working, we need to go back to look at the master system and how can we support that, right? Chiropractic care. Massage is good. Chiropractic care is more effective. I love something called raindrop therapy. It's very relaxing to the muscles around the spine. It uses pressure techniques and things like that. Some people use acupressure or acupuncture. I don't know about that, but I know that if we can affect the master system, the nervous system, I have seen miraculous results with that. So again, chiropractic care, massage, raindrop technique. I have seen people who like have had really bad damage. I could go on, and those things have brought people back to better health, minimally, in most cases, 30%. And for someone who is miserable, living a miserable life because of whatever they have going on, 30% could be life to them. So I hope this was helpful. I hope that you can pass this on. So this is what I would ask for you right now, is that you take this recording. I will get it. I'll put it. It'll make sure it's on our YouTube channel. Make sure you subscribe to our YouTube channel if you don't, because you'll get updates every time I do a new YouTube video, which is usually a couple a week. And you'll have that. And now you have a tool. Who do I know? Right now, you can go put on your Facebook page, who do I know that is having issues with acne from their mask? This might be some solutions here. And then you can share this video, right? You can share this video with people you know who might be struggling with these things. And these could be some answers. I'm not the most greatest, chiropractic total wellness doctor, but I know a lot of pieces of the puzzle. I have a lot of resources and a lot of amazing people that I work with that could be a piece of your or someone you love's health puzzle. So please, 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 please share this, okay? Have a good night. God bless your 2021, and I will see you later. Bye-bye.